Hey everyone, it's Liz Mierendorf, acupuncturist here at Isthmus Wellness, and today I wanted to chat with our other providers, two of our other acupuncturists extraordinaires that know a lot about acupuncture for fertility and pregnancy care. So we're going to focus on fertility today. So I specialize in treating pain, and I see a lot of people with back pain, injuries, and I get a lot of questions about fertility, and these gals just have a huge array of knowledge and have helped a lot of people conceive and have healthy pregnancies and babies, whether that's naturally or with the support of IUI or IVF or Western intervention. So I want to pick their brains about how acupuncture can help fertility and what that might look like for people that are looking to explore that. So this is Lisa Littell and Shandon Williams, who have all the experience in fertility. So you guys, I want to know, first of all, when should someone consider getting acupuncture if they're trying to get pregnant?
Yeah, I guess everyone comes when they're ready. I've helped clients that have been, doing an IVF in like a week. Mm-hmm. So real, last minute.
They'll call you last minute. And
yeah,
say,
yeah, and I make it work, because it's an important thing for people. But I would say in general, about 3 months before you're really ready to start trying. So what I learned is anything that you start doing now will affect your cycle in 3 months. So as a way to kind of get the future crib ready or whatever, because they're going to be in there for 9 months. So to get it ready, you want to do 3 months before you're ready to start.
Gotcha. So it's like nesting before the nesting happens, right?
But okay. That's ideal. I would say most people have been in the journey and it hasn't gone quite as planned as things go in life. Mm-hmm. And so then we'll meet kind of wherever they are along the journey. Mm-hmm. I don't care how people get pregnant. I don't know. I don't know what every individual person needs. So I just ask that we just have open dialogue and we meet where they're at and we take it, we just take it cycle to cycle.
Okay.
Some cycles were more aggressive, some cycles we're doing Western stuff. It's all over the board.
Gotcha.
That's my experience.
So how does acupuncture even really help with fertility? I just want to know, I think I understand it as an acupuncturist, but I really want to know in your words, what is the biggest benefit you see to using acupuncture and Chinese medicine as, an adjunct to whatever they're doing to get pregnant?
I find that acupuncture is great at helping the body be more in balance, more in line. Mm-hmm. And so what I always like to tell people is that we can't make anything happen on our own. What we do is help your body act more optimally on its own. Mm-hmm. So what your body needs to do, it can be more efficient and more effective. So if you're seeking outside treatments, those treatments can be more effective, more easier on the body, for the body to handle. Mm-hmm. And then at the same time, it helps your body do what it needs to do in a simpler way.
Gotcha. Okay.
Yeah.
So even if I decided, let's say I was trying to get pregnant and it had taken me, and gotten pregnant in a year or something naturally, and I wanted to go the Western route, mm-hmm. Even if I did that, then I could call and you guys could help me have that be more effective, because I think the statistics are pretty difficult, right, with some of the Western interventions. Some people will be told they have a certain percentage chance of getting pregnant.
Sure.
Can you increase that?
Yeah, well, we can talk about that. So, I feel like no one's really a number, so whatever the numbers are, just kind of let that go. Mm-hmm. But I guess my experience is we'll kind of adjunct with IUIs or IVFs, or sometimes people are just doing timed intercourse with medication. Mm-hmm. So my recommendation, if someone's taking stim medication, is to get an acupuncture treatment in the first 48 hours of that, mm-hmm. to help the body adjust and kind of optimally handle the new medications. If someone's getting an IUI, I recommend acupuncture before or after the procedure. I guess in my mind, I think if they have not been pregnant before, more before, just to kind of open up the body, open up the cervix, things like that, relax. Mm-hmm. If they've been pregnant before, then I'll have them come after the IUI. And then as far as IVF, it's, I guess it depends exactly what the plan is, if it's a frozen embryo transfer or fresh. But a lot of times we'll be leading up like weekly, and then the day of the IVF, it's really, if they do only 2 acupuncture treatments ever with me and they're doing IVF, the most important time is before the transfer and then after the transfer.
Gotcha. Like
Yeah.
right away, like the same day. Right?
Same
That's
day.
how I've seen it done.
Exactly.
Okay. Cool.
And and that's just a function of working with women's bodies. They don't operate on 9 to 5s, Monday through Friday.
Really?
No. So, we just adjust and
Yeah.
and make it happen.
Gotcha.
So I have no issues with Western medicine. I think the more the merrier, and if that feels right for a person, then I'll do, whatever they need to support. Yeah,
Gotcha.
exactly.
So I've heard that the research shows they should have the needles in pretty quickly before and after their treatment. Is that right?
Right.
That's why you do it. Like, what if it's more? If it's within 24 hours, is that okay? Or
No.
you want it to be right away?
90 minutes.
Gotcha. 90 minutes.
After they put it in,
even on a Sunday.
Up to an hour before,
Okay.
and then
Yeah.
90 minutes after.
Okay. So someone could call us and get in even if their transfer's on a Saturday or something like that.
Absolutely.
Like, we'll make
We
that
always
work for
accommodate.
people. Good.
we
Good.
usually fall on Saturdays, but yeah,
Okay.
we usually accommodate.
Gotcha.
So.
So what if someone was trying naturally? Sometimes I hear people say, "Oh, it's just stress" or something like that. What do you say to those people?
I hate that.
Okay.
Someone's telling someone you just need to relax and you'll get pregnant. Like there's
Calm
nothing
down.
there's nothing relaxing about a fertility journey.
Yeah, and there's nothing relaxing
Yeah.
about being told to relax either.
Yeah. Relax.
Just
I'll let-
chill.
I'll let Lisa
What do you
take
think,
the lead.
Lisa? Like, do you think that calming, that the stress hormones, maybe? I know you work with that a lot.
We do a lot of support for keeping stress low in the body, and of course when your cortisol levels are high, then your progesterone is low, and so we ideally want to see again that balance, bring everything back
Cortisol
into...
is the stress hormone. Right?
Cortisol is a stress hormone, and in order to make cortisol in the body, it uses the progesterone. So the more that we can bring the body back into a balanced or relaxed state, the more progesterone you have available in order to use to support that second half of a woman's cycle, or even an impending pregnancy.
So even if maybe I haven't had any real fertility issues, or there's unexplained reasons why I'm not getting pregnant, or it just hasn't happened yet, can it be helpful to get acupuncture to help my health and to help my
Absolutely.
hormone levels? And
The act of putting a single needle into the body will start to release endorphins throughout the body. And endorphins are those feel-good chemicals that make you feel all happy and, safe and friendly, and they help you open up. And so sometimes that's all it takes. If you have a stressful day at work, or if you have, just got a ticket from driving wherever you are, or whatever happens, whatever life happens, just being able to relax and have a safe space where you can, feel good is part of it.
Yeah, I agree. I feel like with acupuncture, like we can't stop life from happening, but we can, by treating the energy and the way you feel, we can change the way you respond to life and react to life in a more appropriate way. And as far as treating things naturally, I don't know. I feel like there's usually a reason that in my Chinese medicine brain that people aren't getting pregnant, like even if they get explained or unexplained infertility, like I'll look at because ideally your period should turn on and be bright red, fresh blood for 3 days. There shouldn't be spotting, there shouldn't be cramps, PMS, things like that. This is an ideal, optimal
so even when
cycle.
people say that's normal, it's not.
It's not, and clots aren't
Just
normal
common.
either.
It's
It's all signs that things aren't flowing as they should be. So it's I guess I feel like hopefully people just get pregnant, right? And we can just switch into pregnancy care, but along the way, we can there's mile markers. We can track progress by I had less clots this cycle, or I had more cervical mucus, and my ovulation happened at a more appropriate time. I feel like tried naturally, we have to make sure there's 4 different types of cervical mucus, and we always need to make sure that people are making, the S type, the real kind of fertile egg white, and a lot of people aren't. And if you've been on birth control for a long time, it takes a while for it to come back.
I've heard that.
I've read that it can take up to 18 months, so sometimes it's just about putting the brakes on and being like, okay, just came off birth control, things aren't going, like, what can I do here to reset? And sometimes it's like, for me, I'll shift away from like focusing on the hormones and maybe do more liver support or things like that to kind of clear out whatever they had previously been on, or you know, or if they'd done Western stuff and they were ready to just pause and try something different, or you know,
So
whatever.
I think a lot of people, I always hear a lot of people will say, well, I'll try this and then I'll go get acupuncture, like as a last resort. Do you, and from what I hear you saying, it can be beneficial immediately when you start to try, or you have even made that decision to come off of birth control or whatever.
Right.
It can help just be the healthiest possible to carry a healthy baby. It sounds like, right?
Right.
So just it's a part of the healthy process of fertility and pregnancy care.
It's never guaranteed how long someone's journey is going to be. So I always tell people, yes, you'll hear those stories where they come in for one treatment and suddenly they're feeling great and amazing, and look, now they're pregnant. You know, that happens, sure, absolutely. And for others, it might take a little bit longer. So I always tell people there's no guarantee as to how quick this is going to happen for you. You know, the important part is that it's a journey, and that we track progress along the way, and we check in, and we're making sure that we're seeing changes. We're moving in a direction that feels good for you. And so sometimes it is a couple weeks, couple sessions. Other times, you know, it can be several years. But it's all a part of that individual's journey.
Gotcha. And you guys are so great at just being a supportive part of that journey for people. Everybody comes out of here feeling great. I notice. So I want to ask about herbal medicine and supplements and essential oils. People that, you know, I feel like fertility clients get thrown a lot of things at them by, you know, whether it be their peers, people that have had pregnancies, people that have had fertility issues in their life. They're saying, try this, take this, do this. What do you think is the most important thing for them to do? Or what in your...
Castor oil packs.
Really? That is so
I want to know your opinion. What's your answer? I want to know.
A good prenatal.
A good prenatal. What's a good prenatal?
that's good too.
What's a good prenatal?
Oh, well,
How do you know?
Again, it's like,
Can I just
I
go to
don't
Target?
feel, yeah, no, you can't just go to Target. It's not a one-size-fits-all thing. You know, sometimes I won't start people on a good prenatal. Again, if I feel like their liver's backed up and we're not getting a clear picture of their actual hormone profile, like, but if you back me into a corner and make me say one good thing, I think having the prenatal with the converted form of the folic acid is really, really important. And I think you need to get it from a doctor, a chiropractor, an acupuncturist. Those are the providers that carry the converted forms, as far as I know. I haven't seen them, you know, on the shelves yet. At the
Why is
health
it important
food
to take the
stores.
converted form?
Good question. It's kind of a long story, but I'll make it as quick as I can. So in the, you know, when we used to use a lot of folic acid to like enrich things in the 50s, and what we're seeing is like my mom, you know, did that, and so what we're seeing is like a genetic inability to take the synthetic form of the folic acid and convert it all the way to the usable form. So it's one of those things where folic acid, everyone I think knows how important that is for circulation and for egg quality. So if we're one of those people, and I'm hearing it sounds like a third or maybe more of our population. Okay, so she has it. I am too. I can't convert it all the way. Thanks, Mom. But just kidding.
I'm not sure. I might.
The whole family's on converted folic acid. So you know, if you're one of those, it's like one of those cases where why not do it?
Yeah.
You know, because you're just gonna get a more bioavailable form, and it's
Gotcha.
such a key nutrient. You can test for it. I think the test is $100 or $200. You can request. You probably pay out of pocket. But I just have seen.
So there's no downside to just taking the converted form. Everybody should just take the converted form.
Right. The synthetic form needs to be converted within the body in order for your body to absorb it and use it. Whereas folate, the natural form, what we find in our green leafy vegetables, spinach, broccoli, kale, all that good stuff, that's already usable. That your body can just take and absorb and use it and do what it needs to do without any added assistance. So you can go and take the test, or you can skip paying for the test and just
See how you feel.
take the natural form of folate.
Yeah.
So, okay, so that's good information for supplementation. So you can take someone, if they come in here and they're like, I'm taking all this stuff, here's what I've been doing. You guys seem to be really good at evaluating what it is they're taking and maybe giving them some guidance as far as what's the most important and then what form they should be taking things in, right?
Yeah, not all supplements are created equal. Our bodies are meant to get everything from nature, so anything that doesn't come from nature and is synthetic oftentimes can be difficult for the body to digest and absorb. I feel like less is more. Sometimes I'll see people that are on a lot of different supplements. Plus, if they're taking fertility drugs, I usually try to streamline things. At least in town here, we come off herbs and all of that, especially if they're doing Westerns. So, and I know, what to do in that situation. So,
so if there's someone out there
can
like
help
watching
them
this,
kind of figure it out.
okay.
Yeah.
So if there's someone out there watching this that is trying to get pregnant right now and they're doing all the right things, maybe it's only been a couple months, and they're a little nervous about what the process is like coming in here, how often would they have to come in? Can you just do like an evaluation and, can you see them once a month, just twice a month? What does that look like for somebody who might be nervous about how frequent they need to get treated or the cost or anything like that? What do you think?
Initially when someone comes in, we do a very thorough, in-depth evaluation of their health history, what they've been experiencing, what they've experienced in the past, and what they're currently experiencing. After that, I usually like to see people for about 4 to 6 treatments. I want to get a good idea of what their cycles look like, if their cycle is regular or if we need to start making some adjustments and see some changes. If there's going to be changes, I do want to work with someone a little bit more frequently up front to make sure that things are moving in the right direction. During that time, as we get a better idea of the patterns that we're seeing within the body, we'll make different supplement recommendations, different things to either come off of or things to add in. Castor oil packs are a big one that I like to do, so I usually add those
Tell me
in.
about that. That's like
Castor oil packs, they've been used for hundreds of years. It's that stuff that you find in the back of your grandmother's cabinet in her bathroom. It's always around. And it's really relaxing. You just take a nice flannel or a cloth and you put some castor oil on it. You put it over the skin on the lower abdomen. Put a towel over that with some heat on top of that, and then you just get to sit and relax. And the wonderful thing about castor oil packs is that it's great for improving circulation and bringing blood flow, not just to the uterus, but also to the ovaries. And the best way to have a healthy reproductive system is to have increased and proper blood flow. It's the easiest, most affordable thing anyone can do to really strongly benefit their reproductive system.
That makes a lot of sense.
I have a question.
Easy to do, easy
Can they do that post-op if they're currently trying to conceive, or is it only pre?
No, you only want to do that pre-ovulation. You don't want to cook a baby. So I always tell people no castor oil packs post-ovulation, only after your period. If you have really heavy periods, I usually recommend waiting until after the period because it will increase blood flow, and if it's already very heavy, you don't want to make it even worse. If someone has a very light period, not a lot of bleeding, then sometimes I will recommend that they use it while bleeding up until about 2 days before expected ovulation.
Okay. Gotcha.
Thanks.
Yeah.
So it's different per person, it sounds like.
Per person. So in the beginning, I like to see people more up front, and then I like to spread treatments out. And an ideal situation would be meeting someone twice a month, once pre-ovulation, once post-ovulation, different times depending on the individual and where their body needs more support.
I agree, and I would say I'm very similar to Lisa, and I think, some of my patients will even change cycle to cycle, or like if I see teachers, they'll be like, let's just do the 2 times per cycle for now, and then in the summer, I want to be more aggressive, because I have more time and things like that. So, it's always this kind of flux of deciding where they're at and what kind of urgency they're feeling, or what, just where things are at for the couple, but or for the client. So yeah, my favorite time to meet someone is pre-ov. Like if it's more a blood flow thing between cycle day 3 and 6, if it's more trying to support cervical mucus, maybe a little just before ovulation.
But how would I know which one I am? Will you be able to know that by treating me?
Yeah, we'll talk about it.
I don't know what.
We'll talk about it.
Yeah.
And then in the second part of the cycle, like 5 to 7 days post-ov, this is a natural cycle, like when the implantation's about to start, I think it's a really important time to kind of relax and support the body. So those are my 2 favorite times to treat someone.
Okay.
So.
Okay, great. So awesome. I think that sheds a lot of light on it for people. What would you say about somebody who's maybe had a miscarriage or has had recurrent miscarriages? Can acupuncture help with maintaining pregnancy?
Definitely. I feel like I see that a lot.
It's very common. Very common.
Yeah, usually we kind of will, to help stabilize things, fetus stabilizing treatment or whatever, we'll do like weekly until they get out of the gray area.
Mm-hmm.
So if they have nausea, if they have recurrent miscarriage, things like that, we'll support the body weekly is typically how I go. Until they get like an ultrasound or they just get through that first trimester. There's certain supplements depending on the person and depending on what they're doing. There's also really good Western medicines if they really have a lot of repeat miscarriage. I see a lot of people having to combine those two things.
I find too, having weekly treatments when you've had a history of repeat miscarriage to be really comforting and reassuring. It's almost a target date for the woman to reach each week. You know, I get to go to my next appointment and then you just have to, there's a lot of breath holding in between those treatments, but it gives you something to look forward to and it helps make that time pass a little bit faster.
Yeah, that's nice. What about men? Like, what about the piece we're forgetting
Men!
about?
Oh
Like,
my
can you help
gosh.
with male infertility?
We
or-
can. You know, I don't see a ton of men, but when I do, I would say like sometimes there's been trauma, sometimes there's been a surgery, a varicocele is common, like different issues affecting sperm health and sperm quality. There's a lot of great supplements. I tend to like lean heavy on supplements for the guys, and hopefully they take them. But as far as like a willing guy that will do the acupuncture, I usually recommend acupuncture at least like 5 days before the partner ovulates, so it's a little bit of a timing thing.
Okay.
But right around that, just to kind of increase circulation and things like that. You know, to affect the sperm counts, usually supplementation and acupuncture over a period of like at least 90 days. That's the full cycle.
90 days to affect sperm.
Yeah.
Yep.
Yeah.
So whenever I meet with a woman, I always bring up see if there's a male counterpart to the sperm, because there's two parts to every story. So it's not fair to address one side without also looking at the other side. And sometimes men will be really open to wanting support, and other times not so much. And when they're not, usually what I'll do is I'll ask their partner, do you know if they're taking any kind of supplements, any nutrients, what kind of diet do they have? And we'll spend a few minutes just talking and making suggestions, because that way it gets both parties involved, and it's important.
Yeah,
It is important.
very cool.
Yeah.
Is there anything else that you think is important for people to know about acupuncture for fertility care?
Oh gosh, I mean, there's probably more to it, but
Talk
all
for
I can,
hours, I'm sure.
I know, all I can really say is like it's just such an I really do believe it's such an individual case by case thing. So a lot of what we talked about was broad, but I can assure anybody watching this that if they make an appointment, you know, if they're in town with us or someone in their area, that you know that. See an acupuncturist that specializes in fertility, and then I can guarantee that that person's going to really get into the details with them. And then as far as like pregnancy care and stuff like that goes, I think we can get into that maybe in a different video and just kind of keep this about the fertility. But I think that that's an important piece then to be looking forward to as well.
Yeah, postpartum care. That's
The
another
fourth
big one.
trimester.
Right.
Yeah.
So maybe we can explore that and further information, because I know it's asked about quite a bit, and people want to know, you know, why and what should I do during that time just to kind of optimize health and prevent, you know, kind of all of the emotions from overtaking, you know, throughout the process, because it's important to have allies, you know, people on your team and people here to support you like Lisa and Shandon. Not only are they very knowledgeable, they're also awesome allies and people. You know, they become friends with a lot of their clients essentially, you know, in that expert way, where they're just a huge asset to have on your team. So, and I say that working with them because I admire them as providers, especially in this realm. So I appreciate having you guys. Is there anything else you wanted to mention?
It works.
It works. Babies due when?
February 14th.
My birthday, just for the record. All right, thanks guys.
Thank
We look
you.
forward to
Thank
seeing
you.
you again.